Hi, my name is Aisha, and for my FSE, I'm going to be explaining how to give a patient an intramuscular injection, also known as an IM injection. Intramuscular injections are a shot straight into your patient's muscle. They are used because it absorbs the medication into the bloodstream fast. They are also used for many vaccines and supplements such as vitamin D. When it comes time to give your patient an intramuscular injection, it's important to note that depending on the volume, dose, the size of your patient, and their age, you may have to use a different muscle than you were expecting. For example, there are 4 commonly used muscles. The most commonly used is your deltoid muscle. To locate the patient's deltoid muscle and where to inject, you must palpate and find the acromion process, which is the back of the shoulder blade and where your clavicle ends, where they meet. Palpate for that bony area, and once you find that, make sure you go 2 to 3 finger widths down from that so that you're at the thickest part of your shoulder, that muscle. And once you do that, you're able to inject your needle at a 90-degree angle firmly into the arm. The deltoid is most commonly used for vaccines, and because it is easily accessible, the only thing that you must know is that it cannot be used for any viscous substances or anything over 2 milliliters, because it is a smaller muscle compared to the other muscles. And since you can't use any viscous substances, you must use a gauge that's between 20 to 25. The gauge is just the thickness of the needle, how much it can disperse through at a time. Also, since this isn't a very big muscle, you should be using a 1-inch needle, and for larger patients who may have a larger muscle, you should be using 1.5-inch, just to make sure that it's fully going in there and that the substance is being injected straight into the muscle. Also commonly used is your ventrogluteal muscle, which is your hip, just located at your hip. It is ideal for medications with larger doses because it is able to hold 3 to 5 milliliters compared to your deltoid, which is only 2. And it can also be used for viscous medications. So as I had said prior, that non-viscous medications, you use a needle that has a gauge between 20 to 25. And for viscous, obviously, you would need a larger gauge size. So you would use a gauge between 18 to 25. This injection site is appropriate for all ages because it is far from all crucial nerves and blood vessels. When you are injecting, it is important to be very careful though, because there is a lot of bony area here, but as long as you follow the right procedure and the right steps, you will be fine. So to find it, you use the heel of your palm and place it towards your hip, and put your thumb towards the groin area and your middle and index finger down. I'm sorry I can't show it, but point them down and separate them into a V shape. And when you are going to give your injection, you are going to administer it in between the V shape. And for this one, you should use for this muscle, you should use a needle with a 1.5-inch needle, just because it is a larger muscle, and depending on your patient's size, again, you may need to size up to a 2-inch. There's also your dorsal gluteal muscle, which is known as your butt. It can be used for injections up to 4 milliliters. To find the injection spot, you would just need to imagine a cross that separates the buttock into 4 different quadrants, and you would use the outer quadrant to avoid the sciatic nerve and any major blood vessels. And once you pick whatever upper quadrant you want, you're going to palpate for any bony landmarks. So you would locate the top of the pelvic bone and the top of the femur and draw an imaginary diagonal line between these two landmarks, and to the midpoint and slightly above is where you would inject. The needle should be about 1.5 to 2 inches, depending on the patient's size again. And finally, there is the vagus lateralis muscle, which is located in your thigh. It's suitable for medications up to 3 to 5 milliliters, and also viscous medications. It is commonly used for infants and toddlers and children under 3. To locate this injection point, you are going to divide the patient. You are going to divide the thigh into 3 sections from the knee to the hip. You're going to divide the patient's thigh into 3 sections like that, and pick the middle section, on the outer side of the thigh is where you're going to inject your needle. So for larger patients, you may need to size up, but for just average size patients, you may use a needle that's 1 to 1.5 inches. For larger patients, usually 2 inches. And for children, you have to go based off of their size, which would be less than that. And this spot, as I said, this muscle can accommodate for up to 3 to 5 milliliters, but for children, it's only limited to 1 milliliter. And like all intramuscular injections, you must clean the skin surface with an alcohol swab before you start the injection, and you must inject your needle at a 90-degree angle for it to be properly performed. And if there's any muscle, for example, your deltoid, if you're going to use that, but there is a muscle atrophy, scarring, or an injury, you are recommended to use a different muscle or the other side. So now I'm going to be demonstrating how to give an intramuscular injection. Obviously, I can't use a real patient, so I'm just going to be using an orange. And just for the video's sake, I did perform proper hand hygiene before, and I am wearing gloves. So obviously, before I get into any of this, when I first go into a patient's room, I want to make sure I have the right patient. I'm giving them the right medication at the right time, the right dosage amount, and in the agreed upon route. For example, if I had already given this injection a couple hours prior and they had done it in their right deltoid, maybe now we have said that they wanted to do it in their left deltoid. So that's just something to make sure. And obviously, when you first go in, you're going to explain to the patient what you're doing, the process, like even if they have already done it before, just in case, because some people do get nervous. And if there's a new patient, you should be doing that anyways. And you're going to explain to them why, what's the medication, what's the dosage, why they are getting it in the first place. So since I'm going to be doing it on a deltoid, I would go in and ask the patient what specific arm they want me to do it on, just because it can leave your arm feeling very heavy and weak after, and just in case they are right arm dominant, maybe they want to use their left arm. And then also, it is fine if your patient is standing up or sitting, but if your patient is scared of needles or something, you would maybe want to have them sitting, just in case they get nauseous or pass out while you're injecting them, just for safety reasons. So obviously I can't show you an orange, so I'm just going to demonstrate on myself before I start. Make sure that when you're going, your patient's shoulder is exposed for you and it is relaxed, because if not, it can be more painful for your patient. And you're going to use the landmarks, your acromion process, which is where your clavicle meets, and your shoulder blade. You're going to find that bony area and go 3 finger widths down from that to the thickest part of your shoulders, so right here. And that is where you're going to inject your needle at a 90-degree angle. Since I'm just going to be using sterile water, I don't have a viscous substance, so I'm just using a gauge between 20 to 25. So to get started, you're going to remove the top of the protector of it, and carefully pull back to Since I am using the deltoid, I want to make sure that I'm not using more than 2 milliliters. But for the sake of the video, I'm just going to be using 0.5 milliliter. So while you are injecting this, it is important to remember that for every milliliter, you should be going in at a speed of 10 seconds. So since I'm using half, I will just be taking 5. And I will be using the Z-track technique, which helps prevent the substance from going into sub-Q tissues and help it just stay in the muscle. So to do that, you want to push down on the patient's skin and pull away to make it a tighter surface. You're going to firmly hold it like a dart and firmly inject it into the patient's skin and push down. So since I have only half of a milliliter, I'm going to take 5 seconds. And then once I remove it, I would cover the patient with a bandage or gauze to make sure that it is all okay. Sorry, just an orange. And then I would make sure that I dispose properly of the needle and all the remaining medication. For example, the needle in a sharp box, etc.